We're all familiar with getting into the car, turning the key, and taking a quick glance at the dashboard. If a light flashes on the dashboard, we know something is wrong, perhaps a low battery or engine trouble, and we take appropriate action. The dashboard of a car also provides a glimpse of how our actions have benefited the car's performance, such as having a full gas tank or regular maintenance. In the same way, the nursing dashboard provides decision makers with information about trends, activity, outcomes, and also to potential problems. Decision makers also receive information about the results of actions taken. It is an innovation in understanding the many factors that impact the work of nurses in a clinical unit by understanding inputs, throughputs, and outputs. The project lead is Nancy Fram, Vice President of Professional Affairs and Chief Nursing Executive.
The nursing dashboard provides an opportunity for the nurse manager and the staff nurses to have a meaningful discussion about their work environment, about the clinical unit, about what is creating the activity in that clinical unit. It provides the opportunity for the nurses to have input about decisions that are made in their workplace, particularly around staffing and staffing patterns.
The Nursing Dashboard project was launched in December 2008 in conjunction with the Nursing Secretariat, Ontario Nurses Association, and the Canadian Federation of Nurses Unions. Wendy Gary, Director for Decision Support, led a team that collaborated to create the dashboard.
Hamilton Health Sciences pulled together a team from Decision Support who are experts in information management and in developing the tools using the data from our data warehouse. The technology existed through the use of Hamilton's Microsoft Business Intelligence and Reporting suite of tools. But as with any indicator development, the most important and critical aspect is defining the indicators and deciding on how to measure them. We wanted to ensure that we didn't just focus on what is the typical measures that we collect related to the input, patients coming into the unit, but rather on the throughput, what is happening to the patients on that unit, and especially the outcome measures, the output of the unit. How are we doing and how are we performing on that unit?
The dashboard uses a web-based interface into a set of metrics displayed in dashboard format. It is very intuitive and simple to use, as Dave Anderson, the Decision Support database developer and administrator, demonstrates.
When you first open up the scorecard, it opens it up to a general view, which shows all our various indicators, a very diverse amount of indicators and diverse types of data, breaking it down into anything from like patient characteristics, nursing characteristics, throughput information and data. In order to get a specific indicator, we'll select the input section. And then if you would like to get some specific information about occupancy rate in this case, I very simply click on occupancy rate. On the right-hand side, it opens up some definitions to remind the user exactly what they're looking at. It also creates a trending graph. We try to use a stoplight approach, a very visual approach to showing areas that may or may not need some attention. Then just showing some numbers that people might have to concentrate and sort through. You can see very quickly that these are the areas that may need some attention.
Naturally, software is only one aspect of this project. Key to the success of the program is a concept of collaborative decision-making that will include clinical managers, program controllers, and the nurses themselves.
Being a frontline nurse, working on a cardiology unit, I know what goes on as far as activity. I can tell you verbally what the day's like, but it's nice to see that there is a tool, electronic tool out there called the Nursing Dashboard, that accurately captures the activity of the unit. Nurses want to be involved. They want to collaborate with managers. They want to provide the best care possible to their patients, and this is our chance to collaborate with the managers and know exactly what is behind the staffing model that they use.
Up until this time, we've had 8 clinical units piloting the nursing dashboard, and it's really our hope that additional clinical units will begin to utilize the dashboard. We are implementing quality councils, and I believe that the nursing dashboard will provide important information to our quality councils, particularly around patient outcomes that they can use to better understand the quality of care that we're providing across our clinical units at Hamilton Health Sciences.
Hamilton Health Sciences would like to thank all of the partners in this project. Because of the efforts of these organizations and the incredible staff at Hamilton Health Sciences, we have succeeded in creating a valuable tool that will enable better understanding of the inputs, throughputs, and outputs within a clinical unit that contribute to nursing workload, support and enhance communication between managers and the nursing staff, and provide managers and the staff nurses necessary information to make better and informed decisions about patient and associated nursing staffing needs within their clinical units. It is our hope that the Ontario Nursing Dashboard will improve nursing satisfaction through collaborative decision-making and support us to continue providing a high level of patient care.